I am Dr. Smita. I am the squint, pediatric and neuro-ophthalmology consultant at Vision Eye Centers. Today we will be talking about amblyopia or lazy eye. Lazy eye is a condition in which usually one eye and sometimes even both the eyes do not develop proper vision. It happens when the brain is unable to process signals from both the eyes together and starts favoring one eye over the other. So lazy eye causes loss of binocularity and depth perception, thereby leading to loss of fine motor skills in a child. It is therefore important to treat amblyopia early. We usually correct the amblyopia by first treating the cause, like performing a surgery on the eye, prescribing spectacles, or correcting the squint. This is followed by patching of the good eye to facilitate the development of vision in the eye with poor vision. The brain loses its plasticity with age, therefore the earlier the treatment is started, the better. If lazy eye is diagnosed at a very early age and treatment is started, vision recovers completely with development of binocularity and even depth perception. So first and foremost, we need to know what causes amblyopia. One of the main reasons why this occurs is if a child has squint. In this condition, while one eye looks straight, the other eye may look inward, outward, upward, or downward. So because of this, the images formed by the two eyes are not in sync with each other. Therefore, the brain tries to suppress the image seen by the deviated eye. The second reason is if a child has different glass prescriptions in the two eyes. A child may be nearsighted, farsighted, or may have astigmatism, that is a cylindrical number. So if the number is high in one eye, then the eye with the lesser number will continue to see well, and the one with the higher number will be turned off, and vision will not develop properly. This condition is known as anisometropic amblyopia. This is usually not easily diagnosed because the child continues to see well with one eye and never gets to know that the other eye is not functioning well until the child gets an eye checkup done. In some cases, the power of glasses may be high in both the eyes, and then vision may not develop in any of the eyes. This is known as ametropic amblyopia. So the third cause is cloudiness in the normally clear parts of the eye. Some children are born with a cataract, where the eye's normally clear lens is cloudy, or they may have a cloudy cornea. This can keep vision from developing properly in that eye. Also, there is another condition called ptosis or droopy eyelid, which can block vision in a child's developing eye and lead to amblyopia. All these conditions are thought to affect the eye in the critical period of vision development, that is up to 8 years of age. Any insult to the eye beyond this age does not lead to development of lazy eye. So the next thing is how do we diagnose amblyopia? The diagnosis of amblyopia is made after consultation with an eye specialist. To check a baby's or young child's vision, the eye specialist may cover one eye of the child and watch how well the child can follow a moving object. The doctor may also watch how the child reacts when one eye is covered. If one eye has amblyopia, then the good eye is covered and the child may try to look above or below the patch, try to pull the patch off or start crying. In older children and adults, ophthalmologists diagnose amblyopia by checking to see if vision differs between the two eyes by making them read the standard vision charts. After this, a complete eye examination is done to look for any other problem that could be affecting vision. How do we treat amblyopia? So usually the first step is to correct any external cause for the amblyopia. For example, if a child has cataract, a corneal opacity, severe drooping of the eyelid or a squint, then surgery has to be performed for the same. If the child has a high power in the glasses, then spectacles are to be prescribed first. The next step is to facilitate the weak eye to develop properly. So the treatment of amblyopia usually involves making the child use the weaker eye, which is done by applying a patch over the child's stronger eye. In some cases, eye drops can also be used to blur the vision in the stronger eye. Or the child can wear eyeglasses with a lens that blurs vision in that eye. But the commonly used technique is that of an eye patch. Once the patch is applied, the child is asked to read, write, watch TV, or play games. This helps in stimulating the eye to see well. It generally takes several weeks to several months and sometimes even up to years to strengthen the vision in the weaker eye. Once the child's vision starts improving, then part-time patching may be advised for a few months and then it can be slowly weaned off. So the next question which is usually commonly asked to us is which eye patch should be used for the child? The purpose of the eye patch is that it should be comfortable, but it should also stay firmly attached to the eye. The child should not be able to peek around its edges. If a child has a glass prescription, then glasses have to be worn above the eye patch. Most pharmacies have a variety of sizes and types of eye patches. The commonly used eye patches are Bioflex, Opticlude, and Surgiclude. Decorated fun patches are also available online. It's always better to not use the black eye patches with elastic bands or ties because these are very easy for the child to remove and peek around. To wear the patch, it should be simply attached to the skin around the child's eye and removed once the scheduled time for patching is over. So, we should also know how amblyopia can be prevented. Since the diagnosis of amblyopia is not easy, it's usually advised to get the child's eyes tested before his or her third birthday, so that treatment can be started early if required. However, if the child has squint, droopy eyelids, cloudiness in the cornea, or lens, then the child should be seen by a pediatric ophthalmologist at birth and then followed up. Also, if there is a family history of any eye condition, then the child should be examined as early as possible. Over and above this, if the child is born premature or with a low birth weight, then early examination is mandatory. Also, what can be done if the vision does not improve with patching? So recently, many forms of vision therapies have been introduced that help to improve vision in children who do not comply with patching or in whom vision does not improve even with patching. These therapies are in the form of computer games or virtual reality devices in which the lazy eye is stimulated using a high contrast image as compared to the better seeing eye. It was once thought that vision may not improve after the child attains the age of 7 or 8 years, as the brain loses its plasticity after that age. However, now therapies have been helping in improving vision even in adults over the age of 18 years of age. These work on the principle of perceptual learning, where the brain is trained to process visual information by performing repetitive tasks. So I'll just conclude this session by highlighting some of the few key points. First is, it's not easy for parents to notice that a child has amblyopia unless there is a visible ocular deformity. So early eye examination is important. Secondly, if lazy eye is diagnosed, then starting treatment early is mandatory. Once the patching is started, it should be continued till vision becomes equal in both the eyes, or the ophthalmologist feels that the patching is not helping. Then the child can be shifted to an alternative treatment. I hope this live session was informative for all of you. Thank you.